We continue to keep tabs on the coronavirus around the world. The WHO has announced on Tuesday that there is a new scientific evidence which suggests that it may be possible to get COVID-19 from airborne transmission. They claim that while more evidence is still needed to make a definitive statement, recent studies show that airborne transmission cannot be ruled out in poorly ventilated spaces where physical distancing may not be practiced. So we are joined on the line by Dr. Erica Wheeler, PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom territories, who will shed some light on this. Good morning, Dr. Wheeler.
Good morning, Carrie. How are you this morning?
I'm doing quite well, but a little bit worried as this new information has surfaced, and we want to ventilate that a little bit. Forgive the pun. So, what can you tell us about this new development? Is the coronavirus now airborne? Have they discovered that it can be transmitted airborne?
Okay, so thanks, Carrie, for that question. And we really do need to clear it up. Now, you may have known, because you guys are very well read, as I can tell, that WHO has been doing studies on the modes of transmission of this virus for quite some time now. So we have always said that the main mode of transmission is through droplets, and that's why there was the advice to stay at least 3 feet or 1 meter away, minimum distance, but also all the other public health measures. So when we start to talk about airborne transmission, WHO, there are a number of mathematical modelers, physicists, and engineers who are part of the wider group of people who are doing tests looking at what are the possible ways that the virus can be transmitted. So this is something that's always been part of the research. Now,
Right.
most of these, if not, most of these experiments have been done in laboratories, okay? So again, this is a new virus and we're learning about it. But what the evidence so far has shown, when we use the term airborne transmission, it's used very loosely in the
Okay.
sense that it says that it makes it sound as if it could be anywhere, like if you are going out for a walk in the street. But to date, all of the evidence is showing, and as I said, it's evolving,
Right.
that it is right now in confined spaces and where ventilation is poor
Okay.
and you can't do physical distancing. Now, since the 1st of April, WHO has been in weekly, if not more than weekly, contact with their group of scientists, epidemiologists, clinicians, as I said, the mathematical modelers, the engineers, the physicists, looking at the evidence, 500 to 1,000 papers a day sometimes, doing what we call systematic reviews, looking at all of the evidence from everywhere. So all of those things will be put together in a upcoming comprehensive package of information about all the modes of transmission. But to date, what WHO is saying that there is some evidence in those settings. And let's just think about it practically, Carrie.
Okay.
If you cannot physically distance, because remember, they're not only talking about Trinidad and Tobago or the Caribbean when WHO gives out evidence, it's globally. For example, if you live in a household where there are many, many different people, if you live in a crowded household,
Right.
if you live in a slum in Brazil or in South Africa, you can't do physical distancing. You don't have proper hand washing facilities. There's poor ventilation. So thus far, what WHO is saying is that it is possible that it could be airborne in those particular circumstances. And of course, and above all, please, please do not let us forget, when we talk about aerosol transmission, the
Right.
persons most at risk are health workers when they are doing what they call aerosolized treatments for persons who are in the ICU, and it's giving medication, and that medication produces very, very small droplets called aerosols. So in those situations, health workers are most at risk. That is why proper personal protective equipment is so important. So, still, we're saying yes, there's a possibility, but we're seeing that it is in specific situations, crowded, poor ventilated, ventilation, and where you can't practice physical distancing.
So there are many factors that have to be in place for that type of transmission. That was categorized as airborne, and you did give mention to the technical term, the aerosol effect. How does this change our approach to protecting ourselves and protecting others in such settings?
Well, if you think about a setting where you can't do physical distancing, certainly the use of masks. In areas where there's poor ventilation, again, say if, for example, you're in a, well, let's just bring it down to our situation. That's why we're saying to minibuses, open the windows. If you're in an enclosed space, wear a mask.
Right.
Certainly, if it is possible to practice good hand hygiene, but we have to think of all of the situations where that may be possible. If you're in a large crowd, for example, and you are very close to other persons, you don't have the physical distancing. It is also possible that you could be transmitting it in ways other than ways that are airborne, simply because you're in such close proximity to other persons.
Right.
So the use of a mask, and that's what WHO has come to say, the use of cloth masks, and not just any kind of cloth mask. I believe that we have put out some guidance on what type of fabric, but the use of cloth masks in those situations gives some layer of protection. We cannot say 100% because
Right.
we know that the N95 masks are the masks used by health workers that protect them 95% of the time because it is a specially designed mask. But you will have, in those situations, then wearing a mask is one of the tools that we need to practice, along with the hand hygiene and so on. So, as I said, these are specific situations, and we should wait on the comprehensive package of guidance and interventions that WHO is going to be putting out within a matter of weeks. But we should not panic about the fact that this is airborne and it is just any and everywhere.
Okay, that is some reassuring news. Now, what about the workplace? In some workplaces, you work in offices and you work in enclosed areas where there may not necessarily be the best type of ventilation. Many places are air conditioned, and therefore the air in those places is circulated. What can the businesses and the organizations do to by some means clean up the air around them? Is there some type of agent, some type of I don't know, aerosol disinfectant that they can spray in the air to actually combat that, in an active way?
Well, I'm not sure what are the machines that you have in Trinidad and Tobago, but I know in Europe there are machines that you can buy to purify the air. But essentially, either you open the windows if the ventilation is poor, but in terms of air conditioning, again, we come back to the fact that we do not have sufficient evidence that if you are in an air conditioned office that encourages persons to become infected. We just don't have that kind of data right now. Of course, all of that would have been studied. And I know there was a case of a restaurant where it was said that persons in an air conditioned restaurant got infected, but I don't think at that time any careful study was done about how that transmission actually took place. But if you're in a workplace, then you have to look at what are the possibilities where there is poor ventilation. What are the possibilities of opening windows? If you can't open windows and you have air conditioning, we have no proof that COVID-19 somehow gets into the air conditioning system, just like when you're on a plane, there are filters. What you do have to do is to ensure that your air conditioning system is cleaned maybe more regularly because sometimes businesses don't always pay sufficient attention, because
Right.
even persons who are very sensitive to allergens, when the dust in air conditioning systems reach a certain level, they begin to react. So paying close attention to your environment too, in cases where um, you're in an office, is extremely important. So what I'm saying is we should not abandon all of the other public health measures or
Right.
minimize them because we are now having this conversation about airborne transmission. We still need to pay very close attention to all of those other areas and keep cleaning your surfaces and observing your hand etiquette. Um, if there are specific conditions, I mean, businesses will have to observe this. For example, if there is a meeting and there can't be social distancing, then you either do it via online means, or persons wear masks. So, we still have to be sensible when we look at the measures that can be put in place when we are in these circumstances. And of course, businesses should not encourage people to congregate for a meeting when they can do it online. So minimize
Right.
that, crowding of persons, especially in rooms where you don't have good ventilation.
All right, wonderful. But doctor, this is actually not the first time that this possibility has been discussed by the scientific fraternity. It has come up before, but
Yes.
not much has been done, study-wise and stuff to really pinpoint whether the possibility was this great. Why is it that it has come back now and it took this long for them to take it so seriously?
Okay, so again, when you say take it so seriously, remember we're talking about specific conditions, but it is an excellent question, and let me explain why. For WHO, remember I said sometimes there are anywhere between 500 to 1,000 research papers that are gone through
Right.
a day. We're working with a wide range of scientists. I mentioned some of them, the epidemiologists, the mathematical modelers, the engineers. But there is a process in WHO through which any evidence has to go, because all evidence that's put out by WHO is for the global community. That is a heavy, heavy responsibility. So
Definitely.
it means every week there is a meeting of hundreds of these groups of people, the clinicians, the epidemiologists, etc. And then when the and then there is research done. So they're always gathering this research. Now, remember, early in the epidemic, you can't have definitive research, and still some things are evolving, and maybe some of the guidance may continue to change as the situation revolves. So we're looking at a virus that we've only known for the last a little over 6 months, right?
That's right.
Remember, some viruses have been around for decades, and the Spanish flu came 100 years ago. So let's put this in perspective. This is a young virus in our experience. And so you have to have a sufficient body of proven data that's been put through rigorous scientific analysis before you can come up with what we call guidelines. There is actually a committee in WHO. I have done it myself. I have been through this process
Right.
of producing guidelines that took me 2.5 years, because you have to gather the evidence. But we are going much more rapidly now. We are meeting every week and in between. So it means that as the body of evidence grows, you see trends and you see data that points in a particular direction. So after 6 months of people all over the world, which is like unprecedented for a pandemic like this, the intense scrutiny, the trials, the lab tests and all of that, they're beginning to come together to point in a particular direction. So this, when that evidence is gathered, it's given to a committee,
Right.
and that committee, which is made up of some of these very same scientists. So they're doing the research, but they're also on the committee with WHO. And headed by persons from WHO, the chief scientists. They then go through that process to say, well, it looks like it's possible that. And that's how we do the research. So it's an evolving process.
Definitely, especially with such a new virus. as well, with so much to learn still. Before we go, you did mention earlier that the WHO had put out some guidelines as pertains to the type of material for masks. Could you just underline that for us one more time for those who may have missed it in any of our previous conversations?
Okay, so there was a time when WHO did not encourage the wearing of masks in public. But what WHO has since said is that for some situations, and again, you have to remember, we always qualify what we say. In situations where you can't practice physical distancing, very similar to the one on airborne transmission, and there's community spread and so on, that you can use masks, but they have put out guidelines, which you can find on the internet. Maybe I will find them and pass them to you, Carrie,
Yes.
for what type of material can be used. Because when you think about it, just give it a thought for 5 seconds. If you put a piece of gauze on your face, it's not going to help you and it's not going to help anybody
That's
else.
right.
So there must be guidance to what kind of fabric, what kind of material is best in these situations when we wear cloth masks.
All right. Well, with that, thank you very much, Dr. Wheeler, the PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom territories. Again, always wellspring of knowledge and giving us so much information that is so very important. And with that, we're going to take a short break and come back with much more. Stay with us.